The Gauteng Department and its partners are marking World Diabetes Day out in Soweto today, and they were highlighting the growing impact of diabetes and also urging employers as well as high-risk groups to also prioritize early screenings and support within the workplaces. To tell us more about this is Dr. Gauhelo Molefe. She's the clinical advisor for health programs at the Gauteng Department of Health. Doctor, it's such a pleasure. Welcome to SA Today. So you joined the rest of the globe today in observing World Diabetes Day, but you did it in Soweto. Talk to us about your awareness drive at Soweto earlier on today.
Good afternoon, Ms. Jolly, and thank you for having me. We had a good day celebrating World Diabetes Day today at Protea South Clinic. We had our health services stores up. We had our community, our school children there. We had our partners, our stakeholders. We had a good day as the staff of Studio 8 and the community of Protea South today commemorating World Diabetes Day.
Why is it so important, Doctor, specifically important that employees do actually, employers as well as employees pay attention to the overall health as well as well-being of their workforce, especially on such conditions that can be super deadly and could directly affect productivity? How do you then impart this knowledge with these various organizations?
It is very important, Ms. Jolly, and we are having the theme for this year's World Diabetes Day. It's know more, do more for the workplace. And this is where we are encouraging our workplaces, our employers, to take care of our employees, to incorporate employee wellness into diabetic lifestyle modification. And with that, we are advocating as health, as the community, as the people of South Africa, Gauteng, to say, let the workplace know that we do exist as diabetic patients and we need to be cared for. That is in the lifestyle, in terms of the diets that is provided at our workplaces, in terms of the stress management that we are taught by, and also lifestyle modification, being allowed to have active days.
That is actually very crucial, Doctor. But let's say now a company does have a wellness program or center, but the employees there don't necessarily get the required assistance, right? Because some of these workplace wellness clinics aren't really fully resourced as your normal doctor's rooms or even some clinics. So how will then government push for more reforms within this regard as well? And also ensure that, in fact, all employers do have such centers and programs for their workforce?
As the government, the Department of Health Gauteng, we take stakeholder engagement very importantly. And employee wellness, occupational health is one of those important stakeholders that we have. What we do is that we liaise with them. Like today, we had a good day where we had a talk with our employee health wellness program together with DIRCO. And we just had a World Diabetes Awareness Day where we were educating our audience on the importance of diabetes awareness. What we also do as the Department of Health is that we know that most of our patients or clients are not found in our facilities. So community outreach is one of the important things that we are also focusing on as health. We outreach to the workplaces, we outreach to the communities. We have stakeholders such as our civil society to come and get us the people that we need to be able to work with and source from the communities and the workplaces. So stakeholder engagement is just a lot.
Absolutely, Doctor. I mean, we do have instances where people are getting sick at work and those around simply just don't know how to respond to somebody being attacked by a certain condition, let alone if they didn't know that you did have such a pre-existing condition. Now, if you recall in my intro, Doctor, there, I spoke about the high-risk groups as well as during my intro that they should be prioritized in terms of early screenings. How would then the organization in itself even identify these individuals, especially when some operate in high stress as well as pressure environments, and the day-to-day expectations as well as challenges of individuals might not even prioritize in some organizations? They simply view their employees as a profit margin.
Awareness, 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 health promotion. We need to make our communities aware. We need to make our employers aware. We need to preach the the basis of community awareness, because in all honesty, as much as health has the services, the responsibility still lies with us, the patients, the clients, the community, the ward councillors, to teach our patients, our communities, how to maintain a healthy lifestyle. Because a sick patient is one that's going to cost the economy a lot, and we cannot afford to have diabetic non-friendly workplaces, because we know that the majority start from childhood up until elderly age who have diabetes, and it's in the best interest of policymakers and advocacy to stop and be able to assist with this.
And maybe, Doctor, I can hear your phone is ringing there. Tell them you'll answer them after our interview. Maybe let's talk about some of the general symptoms that are presented by those that are or could be possibly suffering from diabetes, that one could tell just by observing from the naked eye, just so that they could actually assist, because we do know also that there's different types of diabetes. So we might be, for example, able to assist an individual who needs to get their insulin shot right on time if we do know some of those symptoms.
Yes. So some of the symptoms that we look out for is if you are a patient who is high risk, and this will be a profile where we also teach with awareness to say that the people who are at high risk usually have a family history of diabetes. Also, these are the patients that will be excessively losing weight without a cure. These are patients who experience excessive thirst and also have frequent urination. And this is characterized mainly by urinating at night.
All right.
Hello, ma'am. Sorry to lose you there.
Yes, sorry, Doctor. Unfortunately, your phone was getting in the way of our great conversation there. That is where we're going to have to leave it, Doctor. But thank you so much for that meaningful engagement, Dr. Gauhelo Molefe. They need you out there. Gauteng Department of Health Clinical Advisor of Health Programs. They're urging employers to prioritize employee screenings this World Diabetics Day.